Dallas County is now waiting to see if more people will test positive for Zika here. State and local health officials are gearing up for a possible influx of that virus. And Fox 4's Sean Rabb joins us from our Dallas newsroom.
With a lot to tell you about today, Clarice, Dallas County health officials are waiting for word on test results from the Centers for Disease Control on more possible cases. That Travis County case involves a man under age 50 who traveled to Colombia. The governor announcing a task force on infectious disease preparedness and response today as local doctors are hearing from their worried pregnant patients.
The labs you were waiting on did come in on this patient.
Dr. Patricia LaRue has had lots of inquiries from expectant moms at the Kessler Women's Healthcare Clinic.
We have had a number of calls, mostly from patients who had heard about it and were planning to travel in the area like the Caribbean or South America.
And changing those travel plans.
And so for our pregnant patients, we have written some notes asking that they not plan to travel and hopefully get a refund from their air carrier or their cruise line or whatever.
Pregnant women who've been infected with Zika have had, in some cases, babies born with birth defects.
We actually don't know exactly the mechanism of how this virus affects fetal development, and so our recommendation is that at any stage of pregnancy, people should avoid travel or hopefully avoid being bitten by a mosquito that might carry this virus.
The Centers for Disease Control currently testing blood samples of 4 Dallas County residents who traveled into the Zika outbreak region. Dallas County recorded the first U.S. case of Zika transmitted through sexual activity.
For anyone considering having sex with a person who has come back from a Zika virus affected country, the advice is to use protection.
Parkland infectious disease doctor Pranavi Shuramoju, the county hospital creating a screening process to identify patients who could present with Zika symptoms.
So we're going to have a master travel screening plan at all points of entry into Parkland.
For both private and public health officials, there are many unknowns.
I want to know how long Zika virus can remain in semen, how long it remains in blood, how the infection affects immune-compromised patients. So there are a lot of unknowns at this point.
And word today of a woman from Spain who traveled to Colombia and in the 3rd trimester of her pregnancy, her unborn infant infected with the virus. The Dallas County Health Department, Clarice, will soon be in the Zika virus testing business, waiting right now for the CDC to certify the lab here in Dallas for Zika testing.
Yeah, Sean, what do we know about the 4 Dallas County specimens at the CDC in Atlanta, and do we know when those test results are expected?
So we don't know a whole lot because of HIPAA laws, but I do know all 4 had traveled to South America or the Caribbean, returning home developing symptoms, which, by the way, can mimic a lot of other viruses. Don't know if it's all men and women, or if anyone was pregnant of those 4. Their primary care physicians, though, were the first to ask all the pertinent questions, and then they made contact with the county health department. And we do know now that the first 2 people with Zika virus here in Dallas County, patient 1 infected in Venezuela who came home, had sex with patient 0 who came home, had sex with someone here. Both of those have recovered.
All right, Sean, thank you.
Okay.